Occupational English Test, Practice Test 2, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you will hear this sound. You will have time to read the questions before you hear each extract, and you will hear each extract once only. Complete your answers as you listen. At the end of the test, you will have 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a cardiologist talking to a patient called Jessica Saunders. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Sanders. I'm the doctor in charge. I just wanted to let you know what's happened and answer any questions you may have.
What is cyanosis? Is it an infection?
Not quite. Cyanosis refers to a bluish colour to the skin and the mucous membranes. Peripheral cyanosis is when there's a bluish discoloration to the hands or feet. It's usually caused by low oxygen levels in the red blood cells or problems getting oxygenated blood to the body. You see, blood that's rich in oxygen is the bright red colour that you usually associate with blood. When blood has a lower level of oxygen and becomes darker red, bluer light is reflected, making the skin appear to have a blue tint.
My baby has that. One of the medics did a hypoxia test to see if the PaO2 would rise or something. And she said it failed to rise, which means the bluish colour is probably due to a cyanotic heart disease.
Yes, that's correct. We have determined that this is probably the case. How much do you know about your baby's condition?
Just that her lips were blue and it was probably due to a cyanotic heart disease. That's all.
Okay, well, firstly, let me reassure you that we are taking very, very good care of her. We've treated your baby as an emergency case, as we should. We've already started the emergency treatment, and I'm here to update you. I have reviewed your baby's x-rays and I can see abnormal positioning of the 2 main blood vessels. Thus, it's likely that your baby has what's known as a transposition of the great arteries. Do you know what that is?
No, can you tell me what it is?
Transposition of the great arteries is a serious condition where the 2 main blood vessels leaving the heart, the pulmonary artery which carries blood to the lungs to absorb oxygen, and the aorta which takes blood from the heart to the body, are swapped over. That's to say, the pulmonary artery is joined to the left pumping chamber and the aorta to the right pumping chamber. This means that blood flows to the lungs and picks up oxygen, but is then pumped back to the lungs instead of travelling around the body. Blood flowing around the body is unable to reach the lungs to pick up oxygen and continue circulating.
So, because they're in the wrong way around, she's not getting enough oxygen to her body?
She is getting some oxygen thanks to another blood vessel connecting the main pulmonary artery to the aorta, but this is not enough. That's why she looks cyanotic or all blue.
How common is this?
Transposition of the great arteries accounts for up to 5% of congenital heart disease, and it's the most common cardiological cause of cyanosis in newborns.
And how is it being treated?
We started a prostaglandin medicine to keep the ducts open because it closes naturally after birth. We will also need to do a balloon atrial septostomy, which is a surgical procedure in which a small hole is created between the upper two chambers of the heart, the atria. This will improve the mixing of oxygenated and deoxygenated blood at the atrial level, but ultimately an atrial switch operation will need to be performed to provide a definitive correction.
But one of your doctor colleagues listened to her heart and said that there were no murmurs. And I wanted to ask what that is, but they were gone by the time I could.
Murmurs? Well, that's that sound, that whooshing or swishing sound. They can be harmless or innocent. Harmless murmurs may not cause symptoms and can happen when blood flows more rapidly than normal.
Extract 2. Questions 13 to 24. You hear a dentist talking to a patient called Chrissy White. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
What brings you here today, Chrissy?
Extreme pain.
It's not that bad, is it?
It started with a numbing pain a few months back. I didn't think much of it, and in fact, when I came back here then, the dentist sent me away with a bit of penicillin.
Yes, I did see that x-ray from the visit. It's a shame that antibiotics didn't do the trick.
No, and now the pain's flaring up again.
What causes it?
Anything and everything, it seems. It's mainly when I drink something hot, but it also happens if I eat something cold, like ice cream.
I see. What type of pain is it?
Like a sharp pain all over my teeth.
Oh dear. With it being a wisdom tooth, it seems that we may have to look at taking it out.
Take it out? I'd rather have a filling if possible, and not one of those metal ones.
Silver amalgam?
Yeah, not one of those. The ones that look tooth-like.
Ordinarily, it is possible to have composite resin filling.
How does that work?
Well, I will need to use a local anesthetic to numb the area around your tooth. Then I'd use one of those air abrasion instruments over there to remove the decay. After that, the area needs to be cleaned of any bacteria and debris so that I can see if the decay has reached the root. We've got to protect the nerve, you see. But when there's enough of a space, I can then add the filling. A little bit of a finish and polish, and we're done.
That doesn't sound too bad at all.
It's not. I really am very good at the procedure. It's one of the first dental procedures that I learned. But in all honesty, Chrissy, it'd only be a matter of time before you're back here again and in even more pain.
So then, what do you suggest?
I'm afraid I will still think extraction is the best option.
An extraction? Oh, now I'm starting to feel woozy.
Oh, don't worry. It's not as major as it sounds. Just like the filling, it's all under the local anesthetic.
Will it hurt?
You'd feel a little pinch when the needle goes into your gum and before the anesthetic kicks in, but that's about it. I'd make sure to numb the tissues surrounding your molar too. I'll even make sure to do some tests around your gums to make sure it's working before we start anything.
Thanks. And then?
Well, then I have to expand your tooth socket. I'll rock it back and forth so that the bone around it compresses and the socket widens. All of this makes it easier to extract.
Would it pop out easily then?
Relatively so, with a little help from the pliers.
What goes in its place afterwards? Don't tell me I'm going to have a big gaping hole at the back of my mouth.
After a few weeks, it's likely the swelling will heal over straight after the procedure. However, it should feel tender.
What about straight after? What happens when the anaesthetics wear off? Can you prescribe me some painkillers?
Of course. What do you do for work?
I'm a receptionist.
Then I'd recommend taking some time off.
Sweet.
Although bear in mind that eating may be a little difficult after the procedure, but only for a few days or so. While you're waiting for the tooth to heal, we've compiled a list of food suggestions for you.
Anything that's not absolutely rancid.
There's pudding, gelato, mashed potatoes, scrambled eggs.
Not bad. Bit of sorbet or yogurt too. This may not be so bad after all.
B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen.
Anne Greenall is undergoing an asthma screening, interacting with a respiratory therapist despite the fact she can't hear a thing. She doesn't have to. A translator is bridging the gap.
I'm able to communicate effectively with hearing people.
The Americans with Disabilities Act requires hospitals to provide effective communication for the hearing impaired in all healthcare settings. It doesn't mandate a method, but computers can't compete.
Of course, there's a lot of technologies out there, but you cannot eliminate the face-to-face.
So you haven't had to use that?
No, I haven't used it.
It sets the patient at ease, and it sets the patient care provider at ease, because Lee Memorial Patient Care Team really wants to make sure that the patient leaves fully understanding their care.
Communication being a two-way street, the translating works both ways, giving health information to the patient but also getting feedback in return. In that way, doctors and health professionals can hear the patient's questions and concerns.
We consider all the people that we work with are deaf consumers. So not only when we come into a situation, hearing people are also people that we're interpreting for.
Anne is all smiles at the end of her appointment. A potentially stressful situation is translated to a pleasant experience.
Let me help you get these slippers off. You did a great job on that walk.
You sure did, Ms. Adams. How are you feeling? Well, I'm kind of glad it's over. It will get easier, won't it?
Oh, it will, hon. It will.
That's what we're working towards. So if you both look at the board here, it's spelled out. Mr. Adams, I'm really glad that you're able to be here when we're walking with your wife, because I think it's going to give you a better sense of what to expect once you're home and how her recovery is progressing.
Oh, it certainly will.
Now, we gave her the pain medication an hour before she walked so that she would feel comfortable. Then, as you saw, when we got her out of bed, we had her sit on the edge of the bed to make sure she wasn't dizzy from the medications. Then we had her stand for a minute to make sure she was okay before she started walking. That's going to be important to continue once you're at home.
Uh-huh.
And we also talked about how it's important for Ms. Adams to get all of her medications on time at home. She's on a blood thinner to prevent blood clots, and walking also keeps her blood circulating and will prevent clotting as well.
Yeah, I really like that little calendar you showed me that has all the times charted out. But, you know, I'm not sure either one of us is clear on the dose of each medicine.
He's right about that.
I'm really glad you told me this. This is exactly the kind of information I need to know. I'll go over the doses now, and we'll review them again when Ms. Adams is discharged. Plus, I have some printed materials to give you when you go home as well.
Thanks. That'll be really helpful.
Today, we're trying to understand and feel confident and competent when providing care for young patients who exhibit anger or aggression. Aggressive behaviors bring the potential for harm. Concern about this is legitimate. It's perfectly okay to be on guard and careful when someone poses a risk. The key is to push through our apprehension, to manage the situation, as well as to provide good care. This kind of behavior in children is sometimes surprising, and many times the intensity and the child's capacity for strength is alarming. In this module, we want to look at two elements of managing these behaviors. First is understanding the underlying reasons why the child may be behaving this way.
Hello, how may I help you?
I would like to make an appointment with Dr. Smith, please.
What would you like to see him for?
I need my annual physical and also have a shoulder problem. It is aching.
Dr. Smith has openings next week. Are you free on Monday or Tuesday?
I am free on Tuesday afternoon.
We will schedule you for next week, Tuesday at 3 p.m. Hi, doctor. I came today because I need a flu shot and to get a checkup.
Okay. Have you had a flu shot in the past year?
No, not in the last few years. My knee hurts as well. I have been running a lot more and think it is injured.
When did the pain start, and does it still hurt now?
About 2 weeks ago, and yes, it still hurts.
I suggest you ice it, and I will prescribe you some pain medication.
Thank you, doctor.
Hello, I'm here to visit my sister.
What is your sister's name?
Her name is Antoinette Simmons. She is going to have a baby.
Oh, congratulations. Yes, I see here Ms. Simmons is in the maternity ward. Do you need directions?
Hello, I'm here to visit my sister.
What is your sister's name?
Her name is Antoinette Simmons. She is going to have a baby.
Oh, congratulations. Yes, I see here Ms. Simmons is in the maternity ward. Do you need directions?
Yes, please.
She is in the East Wing. Take this elevator to the 3rd floor and walk down the hall, then make a right turn. She is in room 304.
Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
The way that we teach clinical history taking at Warwick Medical School is to use the 4 frames. And the 4 frames are a logical way to take a comprehensive history and not miss anything out at all. So the first frame is the presenting complaint and the history of presenting complaint and the systems review and the red flags. So we encourage our students to ask an open question so they can start eliciting the symptoms from the patient. Then we would click into one system. What I mean by that is that if somebody has chest pain, for example, then you would clearly need to ask about all the cardiac symptoms once you've got a lot of detail about the patient's pain using a mnemonic such as SQUITAS, which is site, quality, intensity, timing, aggravating factors, relieving factors, and associated symptoms. I think then it's very important to ask about other systems. So we would do a systems review and then finish off by recapping the red flags. That is, for example, blood anywhere, lumps and bumps anywhere, weight loss, change in appetite, change in bowel habit. The next frame could be the past medical history. We'd ask about operations, any other significant serious conditions. They would ask about the drugs, because they would often be related to the past medical history. And they would ask about over-the-counter drugs as well, and also check on recreational drugs. We will then move on to check allergies and food intolerances. With respect to allergies, it's very important to ascertain whether the patient has any allergies such as to penicillin and what the nature of that allergy or reaction is. The third frame is a social history. So we'd explore the patient's social history. We'd find out how these patient's symptoms and conditions are impacting on the patient's life and occupation. We'd also need to inquire about smoking, alcohol, home circumstances as well, and occupational factors. We'd also then need to move on to the family history, particularly in relation to the presenting complaint and other serious conditions that could run in the family, such as cardiovascular disease, hypertension, or diabetes, or even asthma. The final frame is to explore the patient's values. Why is the patient worried about their condition? So there we would need to explore the patient's ideas about what they think is going on, what concerns them most, and also to ask them about their expectations of how we can best help the patient. Then there should be an opportunity at the end to let the patient ask you further questions, but also if there's any bits of information that they would like to give you. Then usually at the end, it's a good idea to recap the main features of the history back to the patient just to check that you've got all the main facts. And then you could move on to a discussion about the management, which would include an explanation of what's going on, investigations, and follow-up.
Which comes from Mel, who asks if soy milk is messing with our hormones and if there are healthier milk alternatives. We're joined by Olivia Willers.
Hi, Michael.
A lot of us tend to think of soy milk, live as a healthy option. You can find it in the health food aisle of many major supermarkets. What's it actually made of?
It's funny, a lot of us do tend to think of soy milk as, and I guess any other kind of plant-based milk as a healthier option or a health food. And it's certainly a lot of reason that people make the switch now, not just because they're, lactose intolerant or maybe they want to reduce their carbon footprint. But soy milk, it's essentially made from soybeans and filtered water. So it's kind of taking the milk from soybeans that have been pressed, or in some cases, manufacturers will use a soy protein powder. Mm-hmm. And then they add in things like oils and sweeteners and salt to get it to that similar kind of consistency and flavour as cow's milk. And it's also normally kind of fortified with calcium and vitamin D and certain B vitamins, just so it becomes a good, substitute for cow's milk and a good source of calcium.
Okay, so how does it compare nutritionally to regular cow's milk?
Well, nutritionally speaking, it's pretty on par. Soy milk that's fortified is fairly similar to dairy milk, and that's most of the soy milk that we'd find in the supermarket. There's no reason why anyone needs to have dairy milk or cow's milk, but it's certainly a good source of protein and calcium, and it's an easy way, I guess, to get a lot of those nutrients that we need in our diet. That's kind of why it's been a cornerstone of Western diets for a long time. Cow's milk is generally, it's naturally a better source of calcium. But like I said, because most soy milks are fortified now with calcium, they're a really decent substitute for cow's milk. Soy milk's a good source of protein, and soy products, should be a good part of a kind of healthy, balanced diet.
What about fats, comparing milk with milk?
Yeah, so soy milk is it doesn't have, the same, it's lower in fat, it's lower in saturated fat, but milk products generally are fairly low fat. And I guess if you're concerned about the fat content, you've got kind of skim milk as an option, but that is something I guess to take into consideration, that yes, soy milk is lower in fat content.
So soy is also lower in fat, but as I think you mentioned, it's fortified, so along with the natural qualities of soy itself. So you've got iron and fibre, other vitamins and minerals. So is there a kind of recommended blend between dairy and soy in your diet?
Look, I think it's really personal choice. Like, soy is definitely the best kind of substitute for cow's milk. If you're going to not have regular cow's milk in your diet, then soy would certainly be the best option, in contrast to other plant-based milks like those almond milks. Yeah, absolutely.
Okay,
by a long shot.
Well, we'll go back to some of those other milk alternatives in a moment, because a lot of people are opting for those too over soy and dairy. But just back to Mel's original question, she was asking, is soy milk messing with our hormones? And what's the science saying there?
Yeah, so people are a little concerned. There was concern some years ago about this. So soy products contain these things called phytoestrogens, and they're kind of naturally occurring plant chemicals that are chemically pretty similar to the body's natural estrogen, but, they're of a much weaker scale. And soy is not the only food to contain them, but it does have a high concentration of them. And so I guess the discovery of phytoestrogens in soy products led to concerns that they would kind of mimic the effects of our body's own natural estrogen and potentially disrupt our hormones. And there was a particular concern that was raised some years ago when researchers found basically that these phytoestrogens could increase the risk of cancer in rats. But it's very important to point out that animals, rats have a very different metabolism to humans, and studies in humans do not point to any kind of harmful effects.